Each month, we update current healthcare policy news with Swapna Reddy from ASU's College of Health Solutions. And tonight, we hear about efforts to get more transparency in healthcare prices. With that, we welcome Swapna Reddy. Good to see you again. Thanks for being here.
You. Thank you.
All right, there's a plan to make them more transparent. Talk to us about this.
Yeah, so there is a Trump administration plan to make prices more transparent for consumers or patients. And really what the kind of outline of that plan is that hospitals need to release the prices that they've negotiated with insurers for certain procedures, and also need to release how much it would cost patients that don't have health insurance to just pay for procedures or services out of pocket. So, you know, on its face, nothing wrong with that, right? I mean, and sometimes sunlight can be a great kind of disinfectant. So transparency is always a good idea.
Okay, it's always a good idea unless, A, people can't figure out what they're looking at. They got all this responsibility now. And B, maybe the prices wind up going up, increasing.
Yeah, so on its face, sounds like a pretty good idea. The devil's kind of in the details here, right? And we don't have a lot of details, but, you know, kind of best case scenario, the transparency, when we see all the prices, when the consumers see the prices, when the public sees the prices, sometimes, you know, maybe the hospitals will be shamed into reducing some of their costs, or actually even seeing how little some of their competitors are pricing, and then that will kind of price them down sort of based on free market principles.
Right.
You know, the flip side, and that's what a lot of health economists are kind of pointing at, is, well, what does it mean if we actually see the cost of a particular procedure? What does it mean if we understand the price? It's a very opaque system, our healthcare system, right? So just because we see the cost, I don't know that that necessarily makes us more well-informed consumers. And can we actually shop around? I mean, what if our physician or our specialist is at a particular hospital, right? So what does that do for continuity of care? What does that do from like a trust perspective? I think the answers are really unclear there, and in some cases might even increase costs.
Increase costs, and could hospitals and providers, could they sue over this?
Yeah, so there are lawsuits coming on the way, and you know, something that's also really important here is that there's a fine for not participating, but it's $300 a day. So $300 a day for most hospital systems is, you know, not particularly steep base. You know, most of them are running on sort of 9-figure budgets. So instead of releasing this information, paying that fine probably won't be that big of a deal.
And the bottom line, I think, for the consumer is you want the prices cut, and that's not necessarily going to happen, as you mentioned.
Yeah.
You also want it clear. I mean, I need to know what I'm looking at here.
Yeah, you know, it's similar to looking at a health insurance plan, right? For any of us that are signing up and sign up every year, it is hard to figure out what that language means. And the way that prices are determined in our healthcare industry in the United States is probably one of the most complicated and most opaque things that anyone can kind of take a look at. And so very unclear just looking at prices. And then I think it actually is putting a lot of burden on patients and the consumers to be able to kind of compare prices, and that's generally not how it works.
So what do you think? Is this going to pass? Is it going to get through? Is it going to be a reality?
So depends on what happens in the courts. There certainly is going to be lots of action here on the courts. I think the main question, what a lot of the economists are saying, kind of the people that are studying this very closely are saying is, I don't know how much of a difference this is going to make. So, okay, we release the costs, we release the prices, we look at it. Unless it's actually going to result in some kind of action, unless we operationalize this in some way to actually increase our power as consumers, or the hospitals are comparing and reduce costs, might just not do a whole lot of anything.
All right, let's move on here. Arizona's trying to get this Medicaid work requirement going.
Yes.
All of a sudden, this thing is suspended. What's going on?
Yeah, it was high drama, right? So we had our Medicaid work requirements request to CMS approved. This is something that actually Arizona has been trying to pass for several years, and it was denied by the Obama administration every single time. In the current administration, there have been many states that have had their Medicaid work requirement approved, and Arizona is one of them. So basically what that said was that everybody who is on Medicaid, all Medicaid recipients need to show proof that they're working 80 hours a month. So that could be in a formal employment position, or also that they're in a job training position, or that they are doing volunteer service. And certain individuals are exempt from that. What's really interesting is we were supposed to go live with this January 1st, 2020, and very recently recently, a letter was kind of quietly submitted to CMS from Access in Arizona saying, actually, we're just going to halt this. We're not going to move forward.
What's that all about? What was going on there?
Yeah, so hard to tell. Wasn't real clear. That letter was pretty short. What was interesting, though, is there was language in the letter saying that there, kind of based on what was happening in the country and in the climate on this particular topic. And what we know in the U.S. right now is there's about 20 states in the process of implementing Medicaid work requirements. But what we also know is we have lots of lawsuits going on in this area. Federal judges kind of across the country have put a halt, specifically Kentucky, Arkansas. Now there's a court case in Michigan, et cetera, on kind of the constitutionality and the legality of these work requirements.
Well, the argument being what? That this, you're trying to put a work requirement into what at its core is something to help poor people.
Yeah, so Medicaid is meant to increase access and increase affordability and coverage for what is considered very poor individuals in the United States. Because we're talking about traditional Medicaid usually. It's a really traditional Medicaid population, right? And what the courts are saying is, look, when we're adding these work requirements, we're actually going contra to the original plan of Medicaid. Additionally, there's really no proof to show that when you add work requirements for this Medicaid population, it's encouraging people to work or somehow people are springing up and working. What's really important to note as well, and I think we don't hear a lot of in the kind of popular narrative, is 60% of the people that are on Medicaid in the United States and also in Arizona work already.
Yeah.
And about another 25% are disabled. And it's really a very small percentage of individuals on Medicaid that can work that, choose not to work.
Yeah, it sounds as though the judges are saying this wasn't designed to be a work incentive program.
Yes, absolutely. And, we only have one state where we've actually seen this kind of implemented and what the results have been, and that's been in Arkansas. And what we know in Arkansas in the first couple of months of implementation, 18,000 people on Medicaid in Arkansas lost their coverage. And we have no proof to show that it's suddenly because they sprung out of there and got jobs. In fact, that's not what the evidence shows at all. What it really shows is they were having a really hard time with the documentation requirements, keeping up with what those requirements were, et cetera.
And Arizona is still committed to this work requirement program. It's just we're going to hold off for now to see what the courts do elsewhere.
From what we understand, Arizona claims to still want to implement the work requirements, but what we don't have is an infrastructure in any way, shape, or form on how we would implement these work requirements, how much it would cost, and as of the moment, we have absolutely no start date.
All right. Good stuff. Good to have you here.
Nice to see
Good to
you.
see you again. Thank you.
Yeah.
Happy Thanksgiving.
Happy Thanksgiving to you.
Thank you very much.